Good morning. I'm Jenny Lewis, President and CEO of Good Samaritan Foundation Dayton. We're truly honored that so many of you are here to share this morning with us. Thank you. This morning, you'll learn how your gifts make amazing things happen through the vital services provided to our community by the Samaritan Health Center, Breast Cancer Patient Assistance, and Mothers Empowered. This event would not be possible without the support from our generous sponsors. Thank you to our grand sponsor, Sisters of Charity of Cincinnati. Our major sponsors are Dayton Door Sales, Dayton Physicians Network, Radiology Physicians, Inc., and Shell & Meyer Structural Engineers. Our supporting sponsors include American Trademark Construction Services, Bob Ross Auto Group, Lunny Marketing Group, Montgomery County Human Services Planning and Development, and VanCon General Contractors. Additionally, I would like to thank my fellow board members who have provided support and guidance to make this all possible. Since the spread of COVID-19, all of our lives have been irrevocably changed. Amid this urgent health crisis, the needs of the most vulnerable in our community have become even more pressing. The difficult economic time we're facing as a country puts donor-dependent programs at risk, and the Breast Cancer Patient Assistance Fund, Mothers Empowered, and Samaritan Health Center are not immune. As countless stories of need pour in, we're doubling down on our commitment to support the homeless individuals and families, mothers and babies, and breast cancer patients who turn to Good Sam Foundation for help. Now it is my pleasure to introduce Sister Suzanne Donovan, Chair of the Good Samaritan Foundation Board of Trustees, to lead us in a moment of reflection and prayer. Sister?
Good morning. I'd like to take this opportunity, first of all, to thank you for being with us today and in the many ways you shared the mission and the ministry we are about. And so I'd like to ask our loving God's blessing on us. Good and gracious God, thank you for the blessings of this day, for the blessings of this ministry, for the many good men and women who share in the work you have given us. We ask that all that we do, in any way that we do it, would not only be a blessing to us, but be a blessing to all those whose lives we touch and are touched by the many works of the foundation. And we ask all of this in Jesus' name. Amen.
I'm Ken Watson, Vice Chair of the Good Samaritan Foundation Board of Trustees, and I'm honored to be with you this morning. We are here today to share the impact of 3 crucial initiatives that save and transform the lives of our neighbors in very real and sometimes unimaginable ways. Last year, we had over 160 attendees and raised over $64,000 to provide 35 homeless individuals and families with medical, dental, and mental health care. 30 mothers and babies have access to an innovative model of prenatal care and parenting education, and 40 breast cancer patients have financial assistance to help them and their families on the road to recovery. This would not have been possible without your generosity and spirit of compassion, which is saving and transforming lives in our community. The Samaritan Health Center, which was formerly known as the Samaritan Homeless Clinic, has been operating for 28 years, serving people who find themselves in need of medical, dental, or mental health care, regardless of their ability to pay. Last year alone, more than 2,200 patients were served at the center by caring professionals who provide comprehensive health care aimed at improving the health of our entire community. The center continues to be a much-needed refuge for those who need easily accessible, high-quality health care. The team at the Samaritan Health Center goes above and beyond to deliver high-quality care, working tirelessly to help patients get their lives back on track. The respect, dignity, and compassion patients are treated with is often the missing ingredient necessary to set patients on a path to safety and stability. I know we have some clinical staff joining us today, so please know that we see you and we see the amazing and often unnoticed work you accomplish each day. Breast Cancer Patient Assistance provides financial help to patients battling breast cancer who may be unable to afford rent, electricity, transportation to and from medical appointments, prescriptions, the list goes on. Breast cancer kills approximately 1 woman in the United States every 13 minutes, robbing us of our mothers and grandmothers, our sisters, our wives, our best friends. No one knows what causes breast cancer or how it can be prevented, and there is currently no known cure. Breast cancer patients who need assistance have usually exhausted their disability benefits and are not able to work as they recover from surgery, continuing their radiation, chemotherapy, and other treatments. This vital initiative helps in significant ways to reduce the stress that accompanies financial obligations combined with breast cancer treatment. The patients served by the Breast Cancer Patient Assistance Fund consistently report reduced stress, which allows them to heal more quickly and completely, letting them focus on treatment and recovery, not how they'll find money for this month's house payment or water bill. I would like to extend my admiration to the people joining us today who are survivors, current patients, family members, and caregivers. You are a testament to life and an inspiration to us all. Thank you. Mothers Empowered was established in 2011 to help young mothers get access to high-quality prenatal care. In the past 9 years, over 500 mothers have been provided with innovative, quality prenatal care and parenting education through a partnership with Premier Health Specialists, Life Stages Center for Women, Catholic Social Services of the Miami Valley, and Good Samaritan Foundation. Mothers Empowered focuses on reducing premature births, low birth weights, infant mortalities, and building solid parenting skills for the entire family through empowerment, proactive care, and social support networks. Right here in Montgomery County, 45 babies died last year before their first birthday. Helping all children reach their first birthday requires that our first step be to support all women in their parenting journey. Mothers Empowered is committed to providing a continuum of care that empowers families with the tools to have happy and healthy children. Last year, 89% of Mothers Empowered moms carried their babies full term, 90% of babies were born at or above a healthy birth weight, and 82% of moms chose to breastfeed. These numbers are remarkable and should be celebrated. You are truly making a difference in the lives of so many moms, dads, and babies by making sure that everyone can access high-quality prenatal care. Mothers Empowered is dedicated to fighting for the life of every baby. I know we have some Mothers Empowered staff with us today, so on behalf of all of us, thank you for carrying out this innovative work and for being committed to the health and prosperity of our current and future generations. The people who are served by these initiatives are voices that often go unheard in any community. This morning, we have an opportunity to come together to listen to their voices, to answer the call, and to impact the lives of so many people in the Dayton community. Today, I ask that you open your hearts to the inspiring stories of 3 very special people who want to share with you how your gifts have made a difference in their lives. Thank you.
I have my mammograms every year, just like I was told to do. June of 2019, I was told I had breast cancer. I just couldn't believe it because I thought I had done everything. I have a strong belief in God, but when they told me, it dropped me to my knees. Not to pray, but to scream. There's been so many people that have reached their hand out to me when I first found out I had breast cancer. But when I went to have my first chemo, even though I'm in the medical field, I thought I would go in for an hour and I would be done. So when they told me 8 hours, I was like, what? But during that first 8 hours time, Connie came to visit me. That was the first of many visits. Every time I had chemo, she would come and visit me. The thing that really strikes out to me was she asked me, she said, "Rhonda, what do you need?" And so I told her, what I need is help with the medical bills, the chemo, the different office visits that I had.
When I meet with a patient, frequently they would just ask for financial help, or just by talking to them, you'd eventually find out that that was really the need that they had. And a bigger worry sometimes than the cancer diagnosis, unfortunately, more focused on that than their treatment. It's hard to keep up with those unexpected bills. And then when your pay is cut, it's difficult. So many of them really worry that they're not paying their doctor. More so, I think, with paying the doctors than even the rent and the utilities sometimes, because they know that they're helping them so much. We just go ahead and I'd write up a paragraph, a story about their story, about why they needed it, and submit it to the foundation, and then they go on and pay the bill.
She said that she would look into it and see if they would be able to help me with my bills. That was a big rock off my shoulders, because even though I was working, I still was concerned about that, because I didn't know if I would be off work, if I would be able to continue to work, because I really didn't know. They just gave me that support. They made me laugh. They held my hand. And I always had 2 family members with me all the time, which I was blessed to get finished chemo before the COVID virus came, because they were there for me.
I am a mother of 2. I have a son. He's 2 years old, and I'm a new mom to a baby girl, Charlie. She is 3 months. I was going through, I guess, what every first-time mom goes through. What is this type of change, that my body is going through? Am I going to be able to carry a full-term pregnancy? What happens, if I get sick and I'm by myself? It was all of those questions that you didn't know. That process of figuring out, your body and how your body is changing and the unknown was really scary. He was born premature. He was born 34 weeks. So now it's like the difference between him and her. Okay, am I gonna make it, full term, or am I gonna have the same experience? But coming across those questions, it was nice to have my community, of the other patients and the midwives to come back to and say, hey, I've made it to my 36 weeks. Okay, what's gonna happen now? Or what can I expect?
It's providing the moms, first-time moms or recurring moms, with information, knowledge, a lot of support, and like I said, a lot of resources and referrals as far as even if they need a car seat, a crib for the baby, strollers, clothes, Pampers, just whatever they need. It's their doctor's appointment, and most people I know think it's just an ordinary doctor's appointment, but it's a lot more than that. They don't understand all the extra things that go on, the understanding that they get of what's going to go on with their bodies while they're pregnant and after, how to take care of the baby.
Being pregnant and going through the pandemic, it was extremely stressful. Are you gonna survive it? If you don't survive, is your baby gonna survive? You think about all of those things.
Mothers Empowered stepped up. They even provided cell phones for the moms because they had to stay in touch with the midwives. Something going on that they wasn't sure about, then they needed to make that phone call. The impact that COVID had, it's good that the moms had Mothers Empowered there.
I can only go back as far as '07, when I came to Dayton to do ministry, and I like to deal with the elderly. Like I go cook right now. If a friend of mine, elderly friend of mine, calls me, I go cook breakfast for them. If I gotta go to the store, I go to the store for them. I go to the nursing homes around the town before the virus, and just sit with folks, because an hour that I spend with a friend of mine who's in a nursing home and can't get out, that hour to him or her is worth more than whatever money they had in their pocket, or whatever money, because they don't get the attention. When I got introduced to this place, I was taking care of a gentleman. The nurse that came to take care of him took my pressure, and my blood pressure was so high that she wanted me to go to the hospital then, but I couldn't. So she referred me to the homeless clinic. I didn't have a Social Security number for about 35 years, and I've been trying myself to get one. I met Maxine Hill, and she helped me get a Social Security number. She helped me get SSI, stuff that I couldn't get.
Our paths first crossed way back in 2014. He came to the clinic for services, and he told me he was having a problem with his Social Security number. He said, "They tell me it's not my number." I had no clue what to do, so I referred him to a couple of local agencies, and apparently neither did they, because he wasn't helped. I met him again in 2019, late last year, and he had the same problem. And I was angry. Here was a U.S. citizen who couldn't get access to the benefits to which he was entitled. As a homeless patient, he had access to all our services even before I became involved. We have dental services, we have mental health counseling, we have psychiatric care, we have primary medical care, and help people access Social Security disability. We're familiar with this population, okay, and we know what the barriers are, we know what their needs are, and I think we can work very effectively with them to keep them healthy, mentally and physically.
If I need a doctor, all I gotta do is call down here, and they'll send somebody to pick me up, bring me down, take care of me. They gave me medicine. I didn't have to pay for it or anything like that. They constantly monitor my health. I walk in there and I say my name, and everybody in there recognizes Eladio. So I thank all of them, from the receptionist to my Dr. Laura. God put me here to do something, not just to look out for myself. Because if I'm helping somebody else, if nobody else has, I'm glad that I can be able to do it.
When you're looking in and you're not the person that is going through, how it feels to just have some hope that there's somebody there that will help you and understand that you need help. Even though I work, I still needed help. And just knowing that somebody was willing to give me that help, that was a world of a blessing to me and my family. And I want to thank them, all the people that give. I want you to know you are a blessing from God.
I wish that all the people who give money to help the patients, and as a result help the families, could see the faces and the appreciation that they have when they receive this. I just encourage people to continue to do that so we can help more people, more patients and more families get through all of this.
Everything that Mothers Empowered does or is able to accomplish for the moms or the clients, the families, it could not be done without the support that they get in the community.
Keep this program open and available for as long as you can. It's necessary to give women the comfort that is needed while going through the different stages of pregnancy.
I asked the Lord for the blessings on His place, and if He ever gave me any kind of large money, my personal, I would take a lot of that money and just donate it. to keep this place going. The people who's got the money that don't have to worry about doctors, they have to stop and think of the homeless guy that's walking by that doesn't have a home, or the elderly that comes here, We all need some help.
Good morning. I'm Dr. Mylinda Zabramba, a member of the Good Samaritan Foundation Board of Trustees and the medical director for Miami Valley Hospital North. Thank you for being here today to share in this morning with us. I would like to also take a moment and thank each of you who shared your lives with us in that video. You are a true inspiration to all of us. This event is truly a special opportunity for us to highlight the life-saving and life-transforming work that is being done through your gifts to Good Samaritan Foundation. Earlier, Ken mentioned some of the ways your contributions were put to good use over the past year and how we were able to provide much-needed hope, courage, and compassion to so many people in need. I want to take this opportunity to personally thank you for all you've made possible and all that you've accomplished. But there's more work to be done. This morning is your chance to show your dedication and generosity by making sure over 200 people in need can be served in the upcoming year. For so many of us, we look around and see so much need in our community, and we become overwhelmed by it. The COVID pandemic has made the needs of those we serve even greater. In this time of uncertainty, there's a fundamental truth that gives us hope that together we can make amazing things happen. We need your help to make sure that any person who is sick or needs help can go to the Samaritan Health Center and find the doors open, the lights on, and caring professionals who can help them transform their lives. We need your help to make sure that anyone who is facing the unimaginable choice between continuing to fight for their life or paying to have electricity in the winter doesn't have to make that choice. We need your help to make sure that every baby lives to experience their first birthday, take their first step, and gets a chance to live a healthy life. Would that be a gift well invested? Because that's what your gifts do every day, small and large, through Good Samaritan Foundation. Today, I ask you, will you help by giving a gift to 1, 2, or 3 of these initiatives? The time to make amazing things happen is now. Please text the word RAISE 2020 to the number 91999 to make a gift that will make amazing things happen for so many in our community. Thank you.
To close our event, I want to take a moment to thank each of you who have donated today. Through your generosity, homeless individuals and families will have medical, dental, and mental health care. Mothers and babies will have access to an innovative model of prenatal care and parenting education. And breast cancer patients will have financial assistance to help them and their families on the road to recovery. Your support means so much to so many in our community. On behalf of Good Samaritan Foundation and all the people served by these life-changing programs, thank you, stay safe, and stay well.